All right, so thank you again for joining us. Today we're going to be reviewing coverage, or not coverage, but how we look at the data and how we pull that for our clinical topics. As we'll talk about a couple other different areas here, but we're going to be talking mostly about data and the clinical, side of how we use data at WPS. So my name is Rachel Wood. I am one of the nurse analysts with the Provider Outreach and Education team. I'm joined by Mary Sue and Jennifer, and they're also the fellow nurses in Provider Outreach. They'll be helping with the chat as your questions come in. So again, please send any questions that you have as I go through our slides to all panelists, and we will get to them either during our presentation or follow up via email, depending on the questions and how much time we have left. Regarding material, we did include the slides on our live events page. So if you would like to download those, you can go out to our live events page, find this event, and select download to follow along or save these for later use. All right. So we have our disclaimer here. Basically, our disclaimer is telling us that this education is for informational purposes only. And Medicare does change their rules from time to time, so any updates from CMS is going to take precedence over what I talk about today. The rules and regulations that we talk about this morning are current as they stand, but again, anything Medicare puts out following today's presentation does take precedence. We are recording this, so please no photographing or recording for yourself. We will be posting this as a follow-up encore presentation on our YouTube page if you would like to take a look at this or maybe send it to your coworkers. So again, no need to record this yourself. All right, some acronyms that we have scattered throughout our slides here. This is for your reference, and some of these are pretty straightforward, but again, just for your reference if you want to look back as I go through our slides. All right, so that brings us to our agenda and our plan for this morning. So our main goal for today's webinar is for you, the provider community, to understand the uses of clinical data for Medicare and medical review activities. So I'm going to repeat, that statement a couple times as we go through our slides today. I do want to just highlight that based on some of our pre-submitted questions, it seems like some people had a lot of questions about data usage for evaluation and management services. I'm not talking about that this morning. We have done a lot of education recently on evaluation and management. We do have some data-specific presentations out on our YouTube channel. But again, I'm not going to be talking about evaluation and management specifically this morning. So I just wanted to make that clear before we got into our slides. On our agenda, we have this listed on our slide here. So we're going to start by going through data usage for medical reviews, the targeted probe and educate program, and then I'll talk about some quality improvement and innovations happening and some resources from Medicare. So I'm going to break this webinar down into 4 parts. So again, starting with the overview of those medical review topics, and then I'll move into the clinical data that we use for medical reviews and, kind of talk about how we pull that and that process, and then review the Targeted Probe and Educate program, a little bit about how these topics are selected and what topics are, currently we're looking at. And then finally, we're going to wrap up with an overview of the data-driven innovations that are going on with Medicare as well as WPS. So lots to cover in, I believe we have 45 minutes, so, stay with me and we'll get into it. Alrighty, so what are some of the ways that data is used at WPS within our medical review department? So on our slide here, we've listed a couple examples, but I do think that, the data element and supporting information This is really what backs our decisions for, you know, almost everything we do at WPS, as well as, you know, changes within Medicare. Data is really backing almost, you know, all the motives for topics, reviews, changes, and so on. So in medical review, we use data to provide that data-driven education. For example, our provider outreach team, we've been doing most of our webinars specifically for clinical education the last, I would say, over you know, a few months, but you know, more than that really, has been based on our medical review outcomes. So if you've attended any of these topics are what we're presenting on. They're completely data-driven by the outcomes of both our claims as well as our targeted probe educate reviews. Another data-driven education piece would be our claims data that fuels, you know, the selection of these TPE topics. We'll talk a little bit more about that in the next couple of slides. So clinical data and, you know, the development of policies. This is another big area that data is, you know, at the forefront. So our policy team, our medical review nurses, and our provider outreach, we all work very closely together to talk about, you know, what are the new evidence-based practices and how should those be reflected within our policy changes. You know, and additionally, how are some of our policies, what are we seeing based in policy or our local coverage determinations, I should say, how are we seeing those impacting claims errors, and, you know, what can we do to provide education to change that? So our medical review data and clinical outcomes are also used to support the quality improvement and innovation. So this occurs both with WPS as well as within Medicare in their innovation department. And when we get into our slides further, I'll talk more about that. And then finally, audits is the final point on our slide here. And we use the data to back our audits, as well as we use the outcomes of those audits from other entities, so other government contractors, other you know, review contractors, to support our educational innovations at WPS. So for example, you know, a recent audit or an audit done for the prior authorization for Medicare claims done by the Office of Inspector General a couple months back showed that Medicare had grossly overpaid providers for some of the services that were included in their audit. So based on those findings, that sparked additional education on the MAC end, so on our end at WPS. And in doing that, we did see a, you know, spike in provider questions and an actual good outcome on specifically for WPS. We saw, you know, some increase in affirmations versus those non-affirmations specifically for prior authorization. All right, so moving, you know, from the clinical data for medical review, I do want to just talk a little bit about, you know, the goals of the medical review department and who they are. So first and foremost, the goal within medical review is to prevent improper payments and ultimately, with their reviews, protect the Medicare Trust Fund. So not every claim that is submitted to WPS is going to undergo a medical review. Some of the reasons that a medical review of claims might occur could be the, you know, to provide a correct benefit coverage decision. This could include claims that WPS has selected for a review or maybe an incoming prior authorization request. Nurses may take the information on claims error rates, and that will further, you know, push the results of those TPE reviews. And from that, our nurses in medical review are going to be who you're working with one-on-one to create and provide those personal education plans. If you are a provider in our TPE program looking to fix or eliminate future, you know, documentation errors or claims errors, whatever the issue might be. So I'll talk a little bit more about TPE in the future slides. But mainly our purpose for medical review and the clinical data for that is to support the implementation of Medicare guidelines and regulations based on Medicare requirements. They look for and hope to identify any billing issues and help providers fix those as necessary, and reduce errors overall, for both national claims and local claims information. So who conducts these reviews? So at WPS, we have a dedicated department that looks at, so they're nurses that look at our claims that come in. They're called the medical review nurses. There are also other contractors outside of the Medicare Administrative Contractor, or WPS, that conduct national medical reviews as well. So these are listed on our slide here. For example, the Supplemental Medical Review Contractor, you might find some of your claims with them, or the Recovery Audit Contractor, or RAC, might be another entity, as well as CERT's not listed here, but they're another group that you might find is reviewing your Medicare claims. All right, so where is the majority of the data in our medical review, that our medical review team, where are they looking at this? Where can this data be found? So by and large, a huge amount of the clinical data is found in the patient's medical record. Clinical data can be gathered from a variety of sources, so maybe the patient portal as an example, but most of what we see and what we request during medical reviews is going to be in that medical record documentation, so those clinical notes. So some important documentation data elements include, the patient's demographics. So we're going to be looking for the basic information. What is their name? What's their date of birth? What type of provider are they seeing? So for those provider demographics, what's the provider name? What specialty? Where's the patient receiving care? So the setting, and then any diagnostic information that applies to that patient. So, why is that patient-provider encounter happening? What interventions are taking place? How is the treatment being provided? How much treatment is being provided? How frequent or often are these interventions occurring? And then, finally, that patient treatment plan and history. So what does the patient's medical history include? What types of medications or other treatments have they previously been receiving? And what will they receive in the future? Why is this a treatment that this person needs, and why is it medically necessary? So all of this information that I just, kind of rattled through, and anything else that is included in that documentation is considered a valuable piece of clinical data. So this information is used to support the medical necessity of that treatment provided, support the service that is being billed, and give us as reviewers, the reason why billing at the level you may have selected is appropriate, and ideally is going to result in the correct payment from Medicare for your provider and your facility. So the documentation in the data is what we're going to be looking at mainly, and it's very important for providers to continuously stay aware that once they're seeing a patient and documenting this information, somebody else is looking at it down the road for audits, claims, and overall reimbursement. All right, so I've talked so far about the medical review uses of clinical data, what we might look at, and now I want to talk a little bit about the data analysis process. So how do we collect data at WPS, and what is our analytic and analysis process to do that? So we use data and clinical data at WPS to focus on the issues that have the greatest potential to improve payment outcomes for the provider community. We have many different job descriptions that would request to conduct a data analysis. So some of these, and specifically in the clinical area, some of these might include our medical review nurses, our policy nurses, our contractor medical directors, and then finally the members of provider outreach. So, myself and very soon Jennifer, we can request data, data searches if we are seeing a lot of questions on a certain topic and so on. So once a issue, an area of interest is identified, a request for that data is sent to our data specialists at WPS. And we refer to this team as the Insight team or Insight analysts. So our Insight team, they are a crucial part and a huge part of the data analysis process. So again, they are going to be collaborating with, our Insight team is going to be collaborating with our medical directors, our medical review nurses, those appeal nurses and that appeals department, policy nurses, maybe provider enrollment if we're seeing an uptick in any of those issues, and our provider outreach team to identify potential issues, gather the data that, tells us where those issues are and how we can maybe provide some additional education, and then create an action plan to hopefully remedy the issues as needed. So some of the things that our Insight team monitors regularly and is going to report to either, provider outreach, policy, or medical review is they're looking for unusual trends or, high provider utilization of a certain service. So for example, our Insight team will monitor areas such as the CERT dashboard. So that's the comprehensive error rate testing dashboard, the medical review inpatient hospitalization, any increases with those, skilled nursing facility inpatient admissions, or any increases to the use of certain SNF services, utilization of outpatient HCPCS codes, and then finally overall top procedure codes that are being used by our Medicare providers. So this information is reviewed at a minimum by our Insight team twice a month, but we will, depending on what the topic is at hand, pull reports more often if we find it necessary. All right, so hope you're hanging with me so far. So I do want to talk now about the Targeted Probe and Educate, or TPE program, and how clinical data is used to pick those topics, drive our education and improve the review outcomes. So I talked about TPE a couple times already, and TPE is a very data-driven process. For those that are not familiar, I'm going to review, the process of TPE. That graphic is on our slide here, and then we'll talk a little bit about, some of the ways that topics can be selected and highlight a few of the currently reviewed topics that we're looking at. So ultimately, the goal of TPE is to use the data-driven education to reduce appeals, decrease the provider burden, so think of the time it takes to resubmit those claims, track denials, and so on, and to improve the medical review and education process. So as I said on our slide here, there is a graphic that shows the TPE process from start to finish. So, how does TPE work, and how does this use of data fit into this process? So we did get a couple pre-submitted questions on just wanting to hear an overview of what TPE is. So I will review what this graphic, includes. So to start, providers are chosen for the program. If they're chosen, I should say, they will receive a letter from WPS to notify them on what claims we're going to be reviewing and what will be the subject for review. So WPS is then going to review between 20 to 40 claims, and during these reviews, we're going to request supporting medical records for the services that we're looking at. So this supporting information is going to be based on the coverage indications that are in a couple different places. It could be the local coverage determination, the national coverage determinations, depending on the service, and then finally information that is included in the internet-only manuals for the service that we're looking at. So based on the results of that initial round of the TPE review, the next steps are gonna vary. So if the claim review comes back as compliant with the coverage guidelines, the billing criteria, and so on, providers will not be reviewed with this topic again for at least 1 year. Again, so on that specific topic. It does not mean that they can't be reviewed for a different topic, but the one that we looked at will be good for at least a year. Now, if the claim review does not come back as meeting all of those coverage criteria, and we find some issues, some of those claims, maybe some of those claims are denied, our WPS nurses will then schedule a one-on-one education session between the provider and that medical review nurse. And once this education session has taken place, the providers will then have 45 days to make any changes, improve any issues, send in any additional information. And after those 45 days, we will then review the process over again, starting with 20 to 40 claims, and then going from there in that cycle. All right, so that's TPE as a whole. And I want to talk a little bit about the data analysis for the TPE topics. And so as I mentioned, the Insight team works with the medical review staff to analyze the claims data. And they're looking for clinical services and topics that are coming back with those high error rates. So any high denial rates, maybe based on missing documentation, possible billing errors. From those topics, we identify repeating topics and topics that we plan to continue our reviews on based off of those TPE results, so those that come back with high rates of missing documentation or whatever other missing element it might be. That's where our provider outreach team typically comes in to then provide additional widespread education to the provider community. So, why we might hold a webinar on a certain topic is that we're seeing continuously high TPE error rates despite, the education we already have out there. All right, so, and the selection of our data analysis or our TPE topics I want to touch on a little bit here as well. So as I said earlier, we look at these topics and, for data reasons. So our medical review team does not typically just choose a topic because they feel like it. That's not what happens. Not saying that it can't be the case or we can't be potentially instructed by Medicare to look at specific topics for various reasons, but most of the time our medical review department selects these topics for TPE review because the data analysis showed a high claim error rate for the clinical service in question in that specific jurisdiction. So, for us at WPS, J5 Part A and B or J8 Part A and B. Additionally, reasons could show missing documentation components and then, obviously billing errors. So the data that we look at for these TPE topics does have to support the minimum of a 20 to 40 claim amount that is being billed in a 3-month time frame. So this is information that our nurses, again, gather from our Insight team for specific providers. So both of these areas collaborate to figure out what topics, would be reasonable to review claims on, and, based on those data results, what might be the best approach to help providers, fix these issues and fix these errors and have a better, approved claim result. Alrighty, so we've listed on our slide here some of the current TPE topics that our medical review department is looking at for J5 Part A and Part B. There are a couple more that they didn't fit but they can be found on our website. So if you're curious of kind of what some of the topics are at hand, you can find this on our medical review website or our WPS website, going to the medical review section, and you do just need to make sure you have the correct jurisdiction selected, because that will filter what pages will show up for you, depending on if you have J5 Part A selected versus J5 Part B. All right, and same thing here. These are topics that we are currently taking a look at and have information posted on for our J8 Part A and Part B. So again, these are on our website. If you would like some more information on any of these topics, please go out to our website and you can find, documentation requirements, kind of a list of what we might be reviewing for, and so on some of the topic specific links that are posted on our medical review pages. Alrighty, so that moves us into our final section of our webinar today, and this is data-driven innovation. So in this section, I'm going to talk about some of the current innovation programs that are happening through the Medicare Innovation Center, as well as some of the Medicare public data resources that they have out there, regarding, for example, health disparities or maybe health outcomes that are in your area. So I find this to be a really interesting piece that not a lot of people know about. The Innovation Center itself could really be a separate presentation. There's a lot of information out there, and a ton of info that goes into each of the programs with their own separate guidelines, data sets, goals, and so on. But I want to talk about this just a little bit today, because it is a cool resource that I think it's overlooked a lot and has a lot of good public information on clinical info that relates to Medicare beneficiaries. So first and foremost, what do I mean when I say innovation? So this is something new, such as an invention or other practice of developing and introducing new things. In innovation, it's often a new product, but it can also be a new way of doing something, or even a new way of thinking. So the Medicare Innovation Center was established by Congress in 2010, and the goal is to identify ways to improve healthcare quality and reduce costs in the Medicare, Medicaid, and CHIP, so the Children's Health Insurance Program programs. The CMS Innovation Center models are alternative payment models that reward healthcare providers for delivering high quality and cost-efficient care. So they can be specific to, a variety of areas. So, maybe a health condition, care episode, a provider type. So frequently targeted provider type example would be primary care providers, or a community. So maybe rural areas, and trying to see how we can get a better payment model in some of our rural communities. Additionally, there is innovation within Medicare Advantage as well as Medicare Part D. So a lot of interesting stuff going on there. And here we have a, screenshot of the CMS Innovation Center objectives. So, and some of their goals. So again, this section of Medicare develops and tests the new health care payment and service delivery models with goals to improve patient care, lower costs, and align payment systems to promote patient-centered and focused practices. So these programs, the new delivery models and some of the payment systems are all eventually assessed on their impact. So whether it's positive, negative, or no impact at all. And then from there, Medicare will decide based on the clinical information if this is something that's worth maybe rolling out to more states, or maybe at a national level. So if it's something that could have an overall good impact on the provider throughout, the national reach of Medicare or not. So some of the current innovation changes Medicare is looking at and is aiming their models to improve are included on the innovation website. And if we have time at the end, I will pull that up just to kind of poke around and show you what I'm talking about there. But some of the key points here, their objectives are listed in this picture. So first, to drive accountable care. Next would be advance health equity and support innovation, address affordability, and then finally partner to achieve system transformation. So I think a really good example of a result of some of the innovation centers, prior models that has been rolled out at a national level is the rollout of the RASNAT, or Non-Emergent Ambulance Transport Prior Auth program. So this program was started, a little bit of background, this program was started all the way back in 2014, and it was started with the Innovation Center with only a few states on the East Coast. So once Medicare ran the cost impact analysis, the data of the impact of this program in those states showed a significant savings for Medicare. So the model dramatically reduced both RASNAT service use as well as RASNAT expenditures by both 72% and 76%. And that in those states resulted in a reduction of about $750 million in the RASNAT service expenditures, with a total Medicare savings of an estimated $1 billion for those beneficiaries with end-stage renal or other severe pressure ulcers. So based on this information and the outcome of this is something that did result in a national rollout. So for us at WPS, that took place in our jurisdiction, J5 and 8, in the spring of 2022. So quite some time since Medicare initially started this testing of that RASNAT program. So that's just one example of how an innovation program can come from the CMS department and can show an improvement in the quality of care as well as the data analysis, and then roll out into a national standard within the Medicare program. If you do want to take a look at this, it can be accessed at innovations.cms.gov. And again, if I have a couple of minutes at the end, I will pull it up. All right, and then the next tool I want to talk about before we pause for questions is our Medicare Data Navigator. And I think this tool is a very cool resource for providers to be aware of. Medicare here provides a large amount of large data sets on this site that have a variety of different focuses. So the reports are often related to the models, demonstrations, programs, or other initiatives that are happening within the Innovation Center that I just talked about. So on Medicare's Data Navigator, providers can view some information that is specific to Medicare programs, as well as their outcomes or maybe specific health topics or care settings. This information does not include any patient-specific or HIPAA information, but does give a more general idea of what's going on in the Medicare population. So one example is the Data Navigator provides national information for Medicare beneficiaries relating to COVID-19 nursing home data, so what that data set looks like. That is one of the topics that is still being updated and provides current information on what those numbers might look like. So say that's a topic you're wondering about, or maybe Medicare just released a different guideline change and you would like to see more information on that. The Data Navigator is a good area to go and look for that. So it looks like we have a few minutes here, and I don't see any questions in the chat. So I am going to just click over to stop sharing this and click over to our both of these websites really quick. So first, this is our Innovation Center excuse me, homepage. And I just wanted to kind of scroll through this briefly. So some information included here. We have the innovation model. So if you click on this link, it'll take you to some more information about what Medicare is currently working on now and what models are currently happening. This next bullet or next area I find to be pretty cool. It's an interactive map. So if we click on here, you can actually see where in the country innovation models are actually taking place. I'm personally in Wisconsin. So if we go down to states, we'll click on Wisconsin and go there. We can see there's not a ton. It looks like 3 in the Green Bay area, and then 2 closer to the Chicago area, or well, more Milwaukee area. But so just an interesting thing to click around with if you're interested. If you click further, it'll tell you a little bit more information exactly on what model and where that model is taking place. So that is the Innovation Center. We also, have a little bit more data and reports here. And then clicking over to the Data Navigator. So this can be found at data.cms.gov. And you scroll down here, this is what I was mentioning with the COVID-19 nursing home data. So you can see it was last modified this last week, and these are the most viewed and I believe most updated data sets as well. So a lot of information, and it does give a nice video about how to navigate this section of their website because it can be a little confusing if you're not familiar. So I'm going to stop sharing that and go back to my slides. So bear with me as I find those. All right, so here we have just some of our resources on this slide. Again, links to the pages that I just went out to, and a link to our medical review page in general. So just a resource or two for you all to take a look at if you would like to click through those links. All right, and now I want to pause for questions and see if we have had any questions come in to the chat.
Hi, Rachel. At this time, there are no additional questions in the chat.
All righty. Awesome. Well, then we will move on through our last closing slides. So here we have our survey on just to let us know what you liked, what you didn't like, what we could do better for future presentations. We really want to hear your feedback and, want to see, what works for you and what doesn't. There, maybe if you would like a demonstration on certain, for this example, a demonstration on how to use the Data Navigator, or maybe some information on, any of these innovation models and kind of what these guidelines include, please let us know. There's a couple different ways you can do that. First, go by using the QR code on our screen here. You can use that to take the survey through your phone. We also very soon put a link to the survey into our chat. And then when you exit our webinar, you're also going to have a pop-up that takes you to the Medicare Qualtrics page. So a couple different ways that you can navigate throughout to our survey. All right, so next thing is proof of attendance. And this is important for those that need continuing education credits. So we provide the Certificate of Achievement, and that is going to be in your thank you for attending email, which sends out automatically like a minute or two after we close our webinar. This can be submitted towards those continuing education units if that's something that you need. So keep an eye out for that. Don't delete it too quickly if you are looking to submit for those CEUs. And then if I'm not seeing any questions that came in, and that's fine. If you do think of anything or you want to review anything, please email us at wps.gha.education@wpsic.com. You have until 3/13 to send those questions in. And again, questions that relate to this topic, please send those. Anything that is claim specific, please send those to customer service. All right, so with that, we are going to close just a minute or two early then. And thank you all for staying with me. On behalf of myself, Mary Sue, Jennifer, and our provider outreach team, thanks for joining us. We look forward to reading your survey comments and having you join us for future WPS events. You may now disconnect.